And let me share the screen. Okay, let's talk about community and global health issues. The thing I think that's really important with community and global health issues is that we're all tied together. Even the CDC has come up with a quote that says, "A disease threat anywhere is a disease threat everywhere." So we're talking about not only diseases like we did with COVID, but it can be the simpler things as well. And so when we go through the slides, I want you to kind of think of that. Now, the first little bit for some of you may seem really basic, and that you probably think, well, what are you teaching college age students, how to brush their teeth and when to shower and things like that? Well, you'd be surprised about how many people are struggling with these common concepts. And because of that, we tend to not only breed disease, but we spread it pretty easily. And it's the basic things that we can do. Now, because of transportation and commerce, we can spread disease pretty quickly in this country and worldwide. So we're really all tied together. And I hope that by the time we get to the end of the slides, you'll think, well, yeah, the things that I do personally may have an effect somewhere else. And what somebody else does somewhere else may affect me here in my own community. So the first question we have to ask is, well, what can we do? Well, the first thing we can do is personal health. So we're going to go through a few of those things and then think about it. Something as simple as proper hygiene, how that may affect your community, your country, or maybe even the world, certainly your family. So we're going to cover mental health more so in the later chapters, but right now we're going to cover the physical side of it. So germs are a big one, and washing your hands is really important. If you can think the last time you were in a restaurant somewhere, and you went to the bathroom, and on the mirror, I'm sure it says all employees must wash their hands before returning to work. Well, that's just a gentle reminder, not only to the employees, but to everybody to say, hey, if you've used the bathroom, you might want to wash your hands. It's not because of it's because of everything that you touch in that bathroom, the sink, the handle on the toilet, the door, everything. So there's one reason why. So as we go through the day and the things that we touch, we pick up germs on our hands. A lot of times what happens is we'll then rub our face, we'll rub our eyes, we'll touch other things. And every time we do that, we spread those germs around. So proper hand washing is super important. And listed on the right there are some guidelines with proper hand washing. Nail biting is another one, only because if you think about the hand washing thing and you're picking up bacteria, sometimes you can't get that out of the nails, and your nails will carry a lot of different diseases and infections. There's been some studies on pinworms, the spread of cold sores. I need to fix that. That says core sores. And bacterial infections. So from the CDC, you can look on their website, and they have a long list of things that occur if you can't break that habit of biting your nails. Anything that you touch and then put in your mouth may increase your exposure to some sort of infection or disease. Brushing your teeth is important too for good dental hygiene, making sure that your teeth are healthy and strong. One reason for that, obviously, is so that you can eat properly and chew foods that are good for you. The other reason for that is if you have poor dental hygiene, bacteria can really grow in your mouth. As we speak, those germs can come out. Of course, as we sneeze, as we touch our mouths with our hands for whatever reason, and then touch something else, the dirtier our mouth is, and it is dirty anyway, the more disease that we can spread. So good dental hygiene is super important. Here are some steps to good dental hygiene. This one is sponsored by Colgate. Obviously, they're a toothpaste company. You can go to their website. You can also see things again once on the CDC website, the Center for Disease Control. Shower daily, there's some studies out with this one, which has really been interesting to kind of look through. In Australia, 80% of people shower. Only about 66% of Americans shower daily. In China, about half the people report bathing only twice a week. So when you look at all that different stuff, well, what does that mean? Well, there's no ideal frequency. to suggest when you should shower. That should really be up to you. They say several times per week is plenty. The caveat there is that, well, if you're grimy and dirty and you've been sweating and you've been out, and you're dirty or whatever, then probably showering more often is important. Short showers, only lasting 3 or 4 minutes with focus on your armpits and groin may be plenty. So if you don't have a lot of time, that's where you can go. Once again, it's interesting to see how many studies are out on this. I've kind of got a smile on my face, only because I think most college age students have no problem finding themselves in the shower. So, but of course there's a few that don't, and there are good reasons to do this. Keeping yourself clean. Once again, the pores of our skin, our hair, all of those places are breeding grounds of bacteria, and if we can clean those things off several times a week, we will not only benefit ourselves, but our communities, and in some cases we'll smell better. Productivity at work and at school is better when people like to be around you. Also part of many studies. Anyway, interesting things when it comes to showering daily. Washing your clothes and your sheets. It's funny, I took a short poll in my health classes here on campus at EAC about with our athletes, mostly because they live in the dorms. I asked them how often do they clean their sheets. I did it anonymously, and you'd be surprised on how many of them go the entire semester without pulling the sheets off their bed and throwing them in a washing machine. Every 2 weeks is common. Oh, there's another typo. Experts say that the clothes and sheets are best if they're washed weekly. So once again, they contain allergens, they contain bacteria, and to prevent allergies or skin breakouts, and in some cases asthma. There's been studies on asthma and clean clothes and clean sheets. So make sure that you get those clean, and you'll certainly smell better. And once again, people like being around you, so that's good too, right? So all right, so when we look at that, right, we're looking at those things can impact not only our family, but our community. When we look at it in a big picture, community health really, as it says on the slide there, we're trying to reduce inequalities by opening access to community health. So if you remember in the first topic, we talked about the primary way to prevent diseases is to prevent them. Well, these are some of the ways that we can. And the secondary way, right, is to recognize that something goes on. And then thirdly, we have to do something about it by going to a facility like a hospital or some sort of treatment center. When we talk about global and community health systems, we're talking about organizations that are trying to make that stuff equal, so that everybody has the same access to the hospital or a treatment clinic, or services that just can give us advice, like picking up the phone and calling a nurse or a doctor. Certainly personal hygiene and self-care strengthens that, because if you're healthy, then you don't necessarily need those services, and then it provides opportunity for other people. We can overload those services really quickly. So by maintaining good personal hygiene and self-care, we don't use those facilities as much, giving an opportunity for other people to use it as well. Globally, we don't exist in isolation. So, well, like I mentioned before, travel and commerce all opens up the opportunity for disease to pass between country to country pretty quickly. So when we look at global organizations, they're focusing on health issues that go beyond just borders. They go, health issues that may affect everybody. So in the next few slides, we'll talk about some of those global health issues. Now, when we talk about these, think about how it's going to affect you and your community. Some of them may or may not, but keep it in mind. See what you come up with. Global health workforce is a big one. We need more people out there with specialized skill to treat people, and it may not be just in our community. However, here in Safford, we still lack a few of the medical professionals that would really help us. We don't have a pulmonary doctor. We have a cardiologist that just comes in a couple of times a week. So there's some things that we kind of lack here in our community. We have a cancer facility, but the cancer doc comes in like once a week. So and that's just here, in our small community in Arizona. What would it be like out there, you know, in third world countries? Certainly, more women leaders in healthcare has been a primary concern. This was mentioned in a couple of different places. World Health Organization mentioned this is a need only because, well, for many reasons, but one is look at the numbers, right? Women make up 70% of the total healthcare workforce, but only occupy about 25% of leadership roles. Now, that may be, I'm certainly by choice in a lot of instances, right? But it could just be that they're not given the opportunities. So, equalizing that just a little bit, there's some influence that women have on organizations that men don't, and vice versa. And I think a better balance. And so does the World Health Organization, and many other organizations that look at it can benefit our communities, not only locally, but globally. Heart disease, cancer, and non-communicable diseases. We'll touch on this more and more as we go through the semester, but this is really, really important. These are diseases that are preventable. These are that can fit in that primary, self-care by eating right and getting proper sleep and handling stress and exercise. We can get rid of a lot of these, or at least lessen our chances of developing these non-communicable diseases. Once again, freeing up all kinds of resources to help fight against diseases that are a little bit tougher, like cancers and HIV and things like that. There's certainly a lot of mental health issues. We'll address this more as the semester goes by as well. This is a global concern. It's not just a concern here in the States. So keep that in mind as we move through this semester. Some of the things that we talk about with behavioral changes and things that we're going to do in this class will lend to helping with these mental health issues. Strong supply chains. This one's important too, in the fact that we have a lot of medications that we can get out there for people. It's just really difficult to get it to them. When we talk a little later in the semester, we'll address this once again a little bit deeper, but this is an issue. Right now, Somalia, for example, is on the verge of famine, and in some locations they're in a full-blown famine. We can get food there, but they don't have the infrastructure for that food to get the people they need it. There's some corrupt government involved there. There's some warring gangs and issues that are going on there. So getting supplies and medical supplies and food to those people are becoming more and more difficult. Of course, there's this issue with climate change and a warming planet. It's affecting water, our use of water sources, things like overfishing. There's lots out there, and I'm sure that you've seen it. Now, when I say that, look at those things with open eyes and multiple sources so that you get a very clear picture of what is real and what may be being said to evoke some sort of emotion in response, because that's the thing too. So we do have some issues, right? There are some things happening that are changing our planet a little bit. How that's happening, why that's happening, certainly up for debate. What does that have to do with us? Well, probably not much, right? Because we grow plenty of crops here in the United States, but in other parts of the world, growing crops and fishing and doing the things that would sustain normal life 20 years ago is really changing now. And so it's putting a lot of stress on those communities. So this is one of those significant reasons. So let's, one more thing, digital health. What's interesting about this one is what we're trying to do is get better at making sure that our medical records flow with us so that we don't get stuck seeing a primary care physician, having to wait weeks for our medical records to reach the specialist that we need to see. And then they order a new test, then we go weeks again before we get a diagnosis. And so something that probably needs to be addressed right away, like some forms of cancer, are taking 6 or 8 weeks to get diagnosed, and so people are getting sicker and sicker. So digital health is one of those things that assist with that, and they're coming up with some pretty cool technologies that allow us to not only collect but share and analyze some of the data that's going on to help us to get better diagnosis and quicker diagnosis. Okay, with that being said, I want you to think about global health concerns and how they influence community health. Now, this is the reverse of the question that I asked a few slides ago, right? So it goes both ways. Now, we may have to put ourselves in different situations. Think of communities outside our own and how some of the smaller things like good dental hygiene or being able to stay clean and have clean clothes and clean homes, how that may affect health. And so, and then once again, why is it that folks aren't able to have clean water to bathe in or to wash their clothes in and to brush their teeth in? That's a global health concern, right? It's now we're looking at that there are influences that maybe be crossing borders that may be influencing the health and well-being of individual communities. So it goes both ways. So think outside your community, I guess is a good way to put it, and put yourself in the place of somebody else, in another part of the world that might be struggling, and try to think of why that is and what you may do, and it may not be something big. It's not like you have to send money, but by taking care of yourself and taking and having good health for yourself, you may free up resources in a very small way that may trickle down and allow other people to receive care that they need. So by you doing the right thing, you may be helping somebody else. And that's just one thing. You could probably think of another dozen. So keep that in mind as we're cruising through the semester, how these things may influence you and others globally. All right, so there we go. If you have any questions, text or email me and look over those slides and let me know if they have any questions.